Hola, hola, amiga. Did you know that there are so many benefits in going with a chiropractor before, during, and after pregnancy? I honestly had never heard of this until I was 36 weeks pregnant with my second baby, and that was because he was in a breech position. If it wasn't for my chiropractor, which, by the way, shout out to Dr. Eric, I would have probably had a C-section due to having a breech baby. In this week's episode, you'll listen to my story about going to chiropractic care as a pregnant mama of a breech baby, and it was an honor to have had this conversation with a special guest. Doctora Angie Recendez is a practitioner who is helping people of all ages regain their health. She helps pregnant women, newborns, children, and grown-ups as well. She is the founder and owner of Bright Futures Chiropractic, located in Arlington Heights, Illinois, and in Chicago's Pilsen neighborhood. Doctora Recendez is a graduate of the prestigious Palmer College of Chiropractic in Davenport, Iowa, and has completed an additional 250 hours of training through the International Chiropractic Pediatric Association to better serve the health needs of pregnant women, families trying to conceive, and children. I am so excited to have her on the show so that you can learn more about chiropractic care. If you are trying to conceive or just had a baby, this episode is for you. And guess what? Doctora Recendez has shared a special offer exclusively for the Viva la Mami community. If you are local to the Chicago area and you're concerned about yourself or your little one, or if you're pregnant or looking to get pregnant in the future and exploring to see if chiropractic care can even make a difference, then for the first 20 listeners of the podcast who mentioned this week's episode during the month of November 2023, Bright Futures is offering their consultation, which is usually $150. You'll get it for only $47. They have two offices, one in the Pilsen neighborhood of Chicago and the other one in Arlington Heights, which is in the northwest suburbs of Chicago. So whichever one works best for you, feel free to call them at 224-764-1644. And again, this is only for 20 slots. So if that's something that you want to explore, give them a call. You don't want to miss this opportunity. I had a wonderful conversation with Doctora Recendez, and I'm sure you'll learn a lot about chiropractic care as much as I did. So no te lo pierdas. Welcome to the Viva la Mami podcast. I am your host, Jessica Cuevas. I am a mother of two on a mission to help redefine the meaning of motherhood as a modern Latina mom. Motherhood can be a complex journey, interwoven in two identities that often make us feel ni de aquí ni de allá. Viva la Mami is committed to providing you with knowledge, tools, and support to navigate the challenges and triumphs of motherhood as Latina moms. On the show, we'll be discussing culturally relevant topics that will help inform and empower you in whichever season you are in on your motherhood journey. We'll be joined by Latina moms, experts and professionals who can offer advice, practical tips, relatable stories, and honest conversations. So bring your cafecito as I invite you to be a part of this space as we create comunidad about the exciting and challenging parts of being a mommy. Ahora, vámonos. Hola, hola, Angie. How are you?
Good. I'm so excited to be here. Thanks for having me.
Yes, thank you so much for being here. I appreciate what you do specifically in chiropractic care. I think it is so important that the Latinx community needs to know more about it. And so by you being here and amplifying your practice and your expertise, hopefully people can consider a chiropractor, especially as it relates to fertility, pregnancy, and postpartum. And so this is like the purpose of this episode, to inform us a little bit more about the benefits of seeking a chiropractor when one is trying to conceive, or when they're pregnant, or, you know, when they're just having, or who just had a baby. And so if you can tell our listeners a little bit more about yourself.
Yes. Soy la doctora Angie Recendez. I am an entrepreneur. I'm a pediatric prenatal chiropractor. I'm a wife. I'm a mom of 3. My youngest is 4 months. My oldest is 4.5 years old. So I'm totally in it with all the new moms out there. I'm like super passionate, just really excited to be here today because I feel like so many people don't know about chiropractic care and how it can help, especially in pregnancy. You know, I've talked to a few individuals who are like, oh, I don't want to get pregnant again because my last pregnancy was just so rough. It was just so uncomfortable. And I'm like, hey, there's other alternatives, other methods out there. So I'm excited to dive deep into that today. My parents are from Mexico, Zacatecas, Mexico. And so I still feel really tied and connected to my roots. But it's interesting because I grew up in a very white dominant neighborhood. And I don't think I recognize the beauty and the uniqueness of being Latina until I was in college and I joined a sorority and I was around other people that look like me. And as a little kid, you just want to fit in. So I feel like I share that unique perspective with some of my fellow individuals that grew up in the suburbs. So yeah.
Yeah, that's awesome. Congrats on the new baby. It's awesome that you and I have a baby that are pretty close in age. So we're all experiencing the 4-month milestones. I'm experiencing the 4-month hair loss.
Oh my gosh, that's so real. I parted my hair the other way just for this interview.
I'm wearing a headband just to cover my receding hairline, which I'm like, I'm making fun of my husband, but now here I am. Yeah. So I know that I prepared a couple of questions, but I'm curious, which wasn't included in the questions that I sent. I'm curious, what made you interested in chiropractic care or being a chiropractor?
That's a good question. I feel like a lot of times, at least I feel, and they tell us in chiropractic college, like for many of you, you didn't choose chiropractic. Chiropractic care chose you. And I didn't actually get my first chiropractic adjustment until I was 18 years old, and I started working for a chiropractor. And when he took my paperwork, some of the things I discussed, I was like, I had asthma. I always had my inhaler. I played soccer, but I always had my inhaler and always had to use it. Growing up, I was always sick, so chronic colds and coughs. And my mom did what she knew was best, and that was go to the doctor, get an antibiotic, get a medication, recover. So I'd miss a lot of days of school, and I just thought that was normal. I didn't realize it was not normal to go a long time without getting sick. And it wasn't until I turned 18 and started chiropractic care as a benefit of working there. And I remember 8 months later, he checked in with me, and he's, what's changed since you've been under care? And I was like, not really, not a lot. I still feel the same. I feel great, maybe more energy, and I sleep better. And so he went through all of the things that I reported I had, and he was like, it says here you use inhaler all the time. How often have you had to use it in the last 8 months? And I was like, you know what? I don't even take my inhaler around anymore. And then he was like, okay, you had here that you get sick about every month, every other month. How's that been? And I was like, oh my gosh, this is the first time in 8 months that I have ever in my life gone this long without getting sick. And that's when I realized, if my mom knew that chiropractic care could have made a difference in my immune system and my health and my chronic colds and coughs growing up, she would have at least explored it or, looked into it. But she didn't know. She did what she knew, and that was to, go the traditional route. So that's how I got into chiropractic care and was super interested in pediatric world. And then fast forward to 2019 when I gave birth to my daughter. She was a preemie at 30. We were induced at 32 weeks due to preeclampsia. And I was already in the pediatric world and realm, but I didn't really understand the part about, we call it the perfect storm. So it's IVF. We did IVF for her to conceive. There's stress along with that, stressful pregnancy. We're in a society that birth isn't as empowering as it could be or as it should be. We were induced at 32 weeks. She was in the NICU for about a month. And so she was born at 3 pounds, 5 ounces, which is the borderline of there's going to be developmental stuff. There's not, we need to monitor her for 4 years. And I fully in my heart believe that if I wasn't a chiropractor or knew at least about chiropractic the way I do, she would have more neurosensitivities, more neurodiversities. And I noticed them during times of high stress or when we're not doing as great with our sugar. And I think I struggled with the fact that was my birth for a long time because I'm I did all the things. I did the chiropractic care. I did the acupuncture. I did all the things. But I feel like Diosito allowed me to go through that journey so I can connect better with the parents that sit on the other side of our table to be knee to knee. It's I get it. I like get not being able to touch your kid. I get going home and not being able to take your kiddo home. Like I get that to my core. And so I don't know. I just always feel like life happens to us in a particular way. We don't always understand it in the moment, but it'll eventually make sense. And that's what drew me to chiropractic. And then what that other personal life event that like drew me even further into, I want to help every kiddo as early as being in the belly, or the moms being able to help them in the preconception world before they have kids. I know one thing that I pose to our young patients that don't have kids, it's, hey, sometimes we plan for weddings for a year in advance, 2 years in advance, but we don't always think about our health that way. Like, hey, have we prepared our bodies a year in advance, even 6 months in advance, to be able to be the healthiest versions of ourselves to then conceive and have a baby and kind of go down that route. So just thinking of our health and our personal health in a different way.
It was meant to be. That's how I think of it with your story. So thank you so much for walking us through your journey in chiropractic care. And I love every single part of it. I didn't know about chiropractic care until I had my second baby. I always assumed that chiropractic care was specifically for older people. And there are some like negative stereotypes about chiropractors, that they just crack your neck and that's it. And then be careful because you can be maladjusted or whatever. And I heard that often in my community with my parents. And then it wasn't until my baby was breached. I found out that my second baby was breached at around 36 weeks. And luckily, my midwife was the one who recommended, go with a chiropractor. And I was like, wait, what would a chiropractor do when I'm pregnant? And here I thought that I was going to get a C-section, that I was going to have to deliver him by getting induced. And I just had all of these, just like worries that even though I had a plan in place that, it might have been ruined. So we'll definitely talk more about that and my story. And I'm sure many patients that you've had and adjusted, I'm sure that it made a whole difference. But before we delve into the conversation, can you explain to our listeners what chiropractic care is, especially for those that were like me that had no idea about it?
Yeah, so chiropractic care is a field of healthcare. I would say our goal with chiropractic care is essentially, and the way I like to describe it is, we're utilizing the bone to stimulate the nervous system to do what we want the nervous system to do. So in our office, we do different scans to give us a window into what is your body doing. One of them is giving us a window. It's called heart rate variability. It's giving us a window into is your nervous system stuck in fight or flight? Is it stuck in exhaustion, or is it balanced? So it's that sympathetic, parasympathetic part of the nervous system. And later on, when we talk about specific to pregnant women, we'll talk about why that specific one is important. The second scan we're giving us a window into is into the autonomic nervous system. So how are the nerves that are coming out of your low back that are talking to your uterus, that are talking to your ovaries, that are talking to your small intestine, large intestine? Those same nerves that are going to those organs are the same nerves that are going to your low back. So sometimes we'll notice the muscles of your low back. So we'll notice like, hey, someone has low back pain. This individual maybe has, heavy periods, irregular periods, maybe some constipation going on. Same nerves, just going to those different areas. And then the third scan that we do gives us a window into how are the muscles firing along the spine. In pregnancy, it's super important because we want the muscles to fire equally on the left side and the right side. And when there's muscles that are firing unequally, you have weight that's moving forward, which is your belly. But if your postural muscles from side to side aren't firing as equal or adequately, it'll make it for a more of an uncomfortable pregnancy, or like super tiring because your body's not utilizing its reserves or its balance correctly. And so you're just trying to fight off gravity versus getting your body back into more of an inline position so you have more energy throughout the day. And essentially, chiropractic in a nutshell is our goal is to allow the body to communicate better so that you can live, happier, easier, healthier life.
There's so much anatomy and physiology involved with this, and how much this can impact either the way that you live in your day-to-day that you don't even think about. And I didn't really know after my first consultation, like how much the nervous system has so much to do with our day-to-day, whether if it's even like anxiety, acne, constipation. I had no idea. And so everything is so interconnected with our body and the nervous system that even a small adjustment can make a difference. And I am all for chiropractic care ever since my chiropractor saved my life and my babies. And so with specific to women's health, either before, during, and after pregnancy, what would you say are the main benefits in seeking a chiropractor?
I would say the main thing right now specifically is stress and anxiety. So we know, like, even trying to conceive and have a baby, stress is a huge portion of it. Your body, when your body's stressed out, it'll produce cortisol. Cortisol travels throughout our body. And so the more that our cells experience or feel this cortisol, your body's going to build more inflammation. Inflammation is not only in our joints, which is pain, but also in our gut, our digestive system, the bloating, constipation, all the things. If we have autoimmune conditions, which a lot of people do, inflammation's not a good thing. And that all, can go back to originate. There's lots of things we can change, right? Added to clean out the diet, all these things. But if there's one thing that I can change that's going to make a biggest impact into all of that, what's the one thing I can change that's going to give me that 60%? It's being able to help our nervous system regulate better and be more in that balance place versus being stuck in fight or flight. The scan results, when we get them, it balances in the middle, and then there's a little box, and it's either in the side of stress or it's nice and balanced. And what does that look like? So if our starting point is in that state of stress, when life happens, and we know life is going to happen, then we're super at the very end, our body's trying to just survive. So our goal is that we can get our starting point to be more of a balanced place. So when life happens, now we're in a place that we can manage, and our body isn't having to figure out and survive and just have an overflow of inflammation throughout our whole body. If it's someone that's looking to get pregnant, a lot of the struggles is like we live stressful jobs, we not eating is great, all the things related to that. When we are pregnant, the main thing there is that we're sharing our bloodstream with baby. And if we're stressed out, we're producing cortisol. So baby's experiencing life the same way we are, but just on the inside. And so there's studies that show that the way our baby's brains are developed is different, and it changes. And a prime example of this would be like moms that were pregnant during COVID, and I was pregnant during COVID. I think even Instagram was flooding with like pictures of these like babies that were like stiff and like almost like six packs and like little muscles. And to me, as a pediatric chiropractor, that lets me know, hey, maybe there was more stress in utero than we thought or we acknowledged or that we normalized. And the other sign for me when I'm looking at a baby is, are they able to hold their head up? And is their body really stiff holding their head up at those early couple days, couple hours after birth? And to us as pediatric chiropractors, that lets us know, hey, there's a lot of tension. The skeletal system just is more further developed, and that's exactly what happens when there is more cortisol. It develops that part of the brain versus the opposite to that. It develops a different part of the brain, more of the emotional regulatory centers. It develops the viscera, the heart, lung, liver, so just different type of development. And so I always go back to, I like chuckle because I remember when I was pregnant, I've always heard my mom and abuelita say, oh, no se estresen, no se enojen cuando están embarazadas porque le va a afectar a su hijo, And I was like, Mom, there's no research. I don't know what you're talking about. And there literally is research to show that my grandma from El Rancho was right, There's this intuition that has been handed down to us. And so what I love about what drives me even more is like a lot of the stuff for chiropractic is rooted in our Latino, ancestries and history. Like before in different areas, they called them hueseros or, voy a ir con, I'm drawing a blank. That person
La sobada?
Yes.
La sobada.
Yeah. And so a lot of the body work is already in our culture and like where we go to our go-to. We'll usually try that before we'll go to a medication. And so I think that's why I'm so, one, passionate about the work that we do, but two, I connect so well with our Latino community because I share that ancestry, I share that history. And for me, I will always say, let's try a holistic approach first. If it doesn't work, medicine, surgery, therapies will always be there, but how can we at least honor the body's ability to heal first and then try other things and add other things to it?
You mentioned that you are a pediatric chiropractor. Do all chiropractors have the same specialty? Like, how can people seek a chiropractor that is focused on what they're looking for depending on their needs?
Yeah, so I would say if you're pregnant looking for a chiropractor, I would look for a chiropractor that has a Webster certification. Webster is a specific technique that helps stabilize the pelvis specific to pregnant women. You can do it on non-pregnant women, but this specific technique is super helpful and supportive and researched for pregnant women. If you're looking for a pediatric chiropractor, we take one class where we learn both things. It's honestly not enough. We spend the majority, 95% of our time understanding the adult spine, which, for many years, which is a traditional thing. Like you knew it as, the thing you go to when you're in pain and discomfort in adults. And so we're really good at adjusting adults. But I wouldn't say that every chiropractor that graduates is trained to see pediatric population. They're not small miniature adult spines. They have their own biomechanics, their own neurology. So it really takes additional classes outside of what we learn in school to be able to fully understand how to properly adjust a pediatric spine.
Regarding the Webster technique, this was something that I also didn't know, that chiropractors can be specialized in specific trainings, and they can even seek like certain populations. And the way that I heard of that was through my midwife, as I shared, where, my baby was breached. And so she was like, make sure that you seek a chiropractor who's specializes in the Webster technique. And so here I am Googling, and I called one chiropractor, and his assistant said, oh yeah, he specializes in that. And it ended up that he didn't. So luckily he called me the day of my appointment. He's, hey, I don't know what happened, but I do not specialize in the Webster technique. However, here's this contact. And luckily I did find this chiropractor, which I think he's like a miracle worker, because it was right within the brink of me being 37 weeks. And 37 weeks is usually that cutoff where if you ever want to do interventions to turn a breech baby, that is the cutoff usually. Otherwise, you're going to deliver a breached baby. And I had days before the 37 weeks. So you can already imagine my anxiety. And so I scheduled that first appointment on that day. And my chiropractor, did the consultation, he did the scanning, and there were a lot of things that he was like, we need to explore all of this stuff besides you having a breached baby. So I was in red with all the bars. I don't even know what they are, but that in that scan, I was all red, and clearly things were never really brought to my attention, and knowing that these were things that can be adjusted. And anyway, going back to my breech baby story, he was like, okay, by Thursday, your baby's going to flip. And I'm like, how is he this sure? Come that Thursday, this was a Monday, that Thursday, literally my baby turned. And that was that same day where I had a consultation with an OB-GYN who would have done my C-section. Mm-hmm. And he was like, wow, that baby flipped. And I was like, yeah, I went to a chiropractor. And that OB was like, oh, don't go with the chiropractor after this. Don't even go in with any more interventions. And so I went back to my chiropractor. I was like, okay, this is what this OB said. This was someone that I really didn't establish a relationship with. He doesn't know my background. I don't know who he was. I just had to have this consultation because that was something that my midwife wanted me to do just in case. Mm-hmm. And my chiropractor was just very offended. He was like, wait, who is he in the position to tell you not to seek chiropractic when I know my job? I know that this can work. He told me the statistics, but I feel that oftentimes people don't know about this. Like the default is just getting a C-section, or like the immediate instinct is to just go based off of what the healthcare specialists provide or what they have to say. But I feel, there are some other interventions and holistic approaches, and I'm all for it. And so what is your thoughts about this? Like, how would you approach this with someone who probably has had a similar experience as me?
They're definitely not my favorite conversations, but what I always say is, if your dentist told you needed a root canal, I'm not going to go and say, don't go get a root canal. I'm not the professional in that department or that realm, but I understand where their hesitation comes from. And I think it comes from research and not enough research, like a lot of the information or the recommendations that are made in the medical world is medicine, right? This is going on. You provide a medicine is funded by the pharmaceutical companies. There's a lot of money that is out there. They pay for lobbyists in Springfield, to change laws to allow for medicine. But at the end of the day, chiropractic care, we just had our birthday in September and we're, I think, 130 years old, So at the end of the day, we're we're a young profession compared to medicine that's been around for years. And so I get their hesitation in the unknown, not enough, wanting to do more research. And I agree, for many years we did a lot of research on pain, discomfort, the opioid epidemic. How do we get people off of being addicted to pain pills? How do we get them out of pain and not have to give them pills? And so a lot of research went into that. I can understand where they come from, but I definitely agree with your chiropractor in that this is our specialty. We're the experts in this field, and I wouldn't be making a recommendation for somebody else's field that I'm not the expert in. So that's how I feel about that. But, I'm glad that you listen to your instinct. And a lot of times, I always say, listen to your mommy, daddy gut, listen to your individual gut, because you know what is right for you. And I can sympathize with that feeling of one professional's telling me one thing, another professional's telling me one thing. What do I do and who do I trust? I always say whatever your gut tells you is the right answer, And even for myself, what I do in my lifestyle in my life might not be right for another family, and what's right in the healthcare decisions that they make. You have to, at the end of the day, be comfortable with the decision that you make. Obviously, I'm glad you went with chiropractic care, and I always say, try the less medicalized route first, and then if that doesn't work, that's always available, And chiropractic care, I'm glad your baby turned, because you're at that kind of end, you have less room, baby's bigger. The longer we wait, still we can turn we can stabilize the pelvis, increasing that chance for that baby to turn. I typically like to recommend that women or individuals that are pregnant get adjusted when they're about 18 weeks. We'll start at 18 weeks, because that's about the time when your body's starting to physically change. And if we start after that, we're playing catch up. And how do we get your body to stabilize? Then we have relaxin kicking into the system, which is that hormone that relaxes all your joints. And then then there's a lot of instability, but we're still trying to keep it all together so you can enjoy your pregnancy to the maximum. So I'd say, preconception is best. The next best time is before 18 weeks. And if it's not before 18 weeks, the next best time is now. And I would say is my recommendation for when should I start?
Yes. And I felt, as he was going through all of the analyses of the scan, I'm like, wow, this is a history load of issues and problems. And he was able to, I wouldn't say cure it necessarily, but he was able to adjust me appropriately, and I did improve. And so can you explain to us a little bit more about that? What kind of focal points should one focus based off of that scan? And what is usually your approach when you are adjusting an individual, specifically who is pregnant or who just had a baby?
Yeah, so the scans will give us a window into, I'm looking for two things. One, we're going to do Webster technique for sure if you're pregnant, because we want to stabilize your pelvis regardless of your baby's position. We want to create an environment, the most amount of room for baby, even when you're delivering, 1 millimeter makes a difference. And so if we can get your pelvis to be more stable in an inline position, that vaginal opening will be, at the position you want it to, more for delivery. But prior to that, if we can get your pelvis to be more stable, equal left, you're going to feel better. Those muscles are going to be firing equally on the left, and that's what we want. But the second part to that is we want to create an ideal environment for baby to turn to a position of less stress. Ideally, that's head down. For some pregnancies and some babies, that might not be head down. And so there's been times where baby, we adjusted, baby didn't turn, and it ended up being that baby had a short cord. Totally random, unlikely to happen, not rare, but it can happen, So I always remind our expecting parents, hey, head down might not be the ideal position, and we have to honor the body and honor and trust that the body knows more than we know, and what is best for this baby that's growing inside. But so that's the pelvis stabilizing position stuff. We're going to look at your psoas muscle. There's 4 structures that hold the uterus together, just like a hot air balloon with 4 chains. 2 in the front would be your round ligaments. 2 in the back would be your psoas muscles. So we're looking to check and address those. If they're tight, tense, usually it'll be opposite sides, opposite psoas, front right round ligament. And so baby will want to turn to that position of less stress. which may not be ideal. So our goal is to target, not only stabilize, adjust the pelvis, but stabilize and release those structures as well. And then utilizing our scans, and the reason I'm passionate about seeing expecting parents early is because we can understand where their nervous system is at. So if an individual's nervous system is stuck in fight or flight, if you think of a cat in nature when it's trying to deliver and it feels like it's being threatened, that's essentially what fight or flight or stress is. It's like we feel like we're being threatened. That cat's going to be like, I don't want to deliver right now. I feel, someone's going to attack me and it's going to eat me and my babies. So I'm going to hold my babies in and not let them come out. When we are birthing, if our nervous system has been in this state of fight or flight, it can, birth is a physiological thing. Like you can't say, all right, hit the on button, I'm going to give birth right now. It's something that happens through our autonomic nervous system. So if our nervous system is stuck in fight or flight, it can slow down, take longer, delayed labor, and so forth. And so if you deliver where most people traditionally deliver, you're in a hospital, and a hospital can be a little bit more sympathetic, putting us even further down that sympathetic route. And so if we can understand that early on, we can change our nervous system, allow the nervous system to adapt better, get us into more of that balanced place. So when we enter that stressful environment, again, we're in a manageable place, versus if our starting point is here and now we're in the stressful environment or that hospital, like now we're further off to the other end. But even more important is that postpartum realm. If we're already stressed out, state of fight or flight, think of the time of your life when you've been the most stressed, and now you're waking up every 3 hours trying to keep another human alive. Like, how much are you really going to enjoy that postpartum phase when your nervous system is still in fight or flight? So if we can, not only for the birth, but let's get you regulated so that when you hit that postpartum realm phase, like you're the best version of yourself to go into this new time of your life where you have to wake up every 3 hours. We've never had to do that. Exhaustion is real, but exhaustion and stress is a lot harder to manage. And I think a lot of the postpartum emotions, hormones, and things that happen is because, stress on top of this new time period. And how can we help support our moms during that time so that they can, express themselves and feel better during that phase?
Yes, absolutely. Yeah. And considering just like the time that we live in, it's interesting what you mentioned about those that had babies during the pandemic, but also there are a lot of changes with our economy, and oftentimes maybe women feel guilty about having a baby when there's so much uncertainty in our world. And I'm glad that at least through chiropractic care, there can be some level of intervention, to help heal the body better. And especially when it comes to labor, I would say I only went with my chiropractor for maybe 3 weeks. But even within those 3 weeks, it made such a big impact in my labor, even my breastfeeding experience. And I had no idea that your labor can be shortened, or if you want to breastfeed, your milk supply can be much higher, through chiropractic care. And I had no idea. And so just knowing about these things and basically what my chiropractor said, I am all for, just women or people seeking chiropractic care, especially to help relieve the stressors that our body usually gets impacted through the environment, through society, the issues that are happening in our world. So as far as with accessibility comes into place, how accessible is it, especially with people from our community? Do you think that it is accessible for folks?
That's a good question. And I thought a lot about this question. And I think it just comes down to value, right? What would, my last baby turned breech, and I would have done anything to avoid a C-section. I did acupuncture. I did literally have spinning babies. I did it all. And I was, what I wanted at the other end of my investment, I was willing to do and to try. And I always, pose the question, what is it, how much would you pay to have, a mom who has a kiddo who isn't talking, nonverbal, delayed, for them to say, "Mommy, I love you." Even to say "Mommy," what's the value of that? What is the value of a new mom who has a colicky, fussy baby who feels like they can't connect with their baby because they just don't know what's wrong? And it isn't like the movies where it's like, "Oh my God, I'm just connected to my baby right now," and that's not happening. What what's the value of that, you know? And I feel like a lot of our parents who are getting these amazing results, who are getting these amazing kiddo who isn't sleeping, or they're not sleeping in their pregnancy or enjoying their pregnancy, you know, like they can't go to work now, they're now bedridden. But if you can get up and walking and moving now, like what's the value of that? And so I feel like a lot of times what our parents will say is that, you know, I'd pay 3 times what I paid to get what I got at the other end of that. So I feel like it is accessible, and, you know, our fees are reasonable and at par with others in our community, but I've never turned anyone away for finances. If it was someone who was struggling or anything like that, it's, hey, how can I figure it out for you? You know, my parents didn't grow up having a ton of money, but they invested in the things that they felt passionate about and that they wanted. And, you know, we offer different payment plans to make it more accessible, affordable. And, you know, we recognize that each individual's situation is different. And if there's anything that I can do to help support in any way, I'm here to help explore that with them.
Yes, absolutely. And is chiropractic care, can people utilize their health insurance with it, or does it just vary depending on the practice?
I would say it varies a lot depending on the practice. Some practices are in network, some practices are out of network. Chiropractic care right now, most insurance companies will cover if you have neck pain, mid back pain, and low back pain. They don't cover wellness. They don't cover if you had a 10 pain scale and then you drop down to 5. You're not at 0, but you're at 5, and it's been like that for a while. They don't cover when you plateau. So it depends by insurance. It depends by the situation. It depends by the diagnosis. Lots of different factors. But it'll cover most adults. The big gray area is for sure kids.
Interesting. I wonder if it's because there isn't a lot of research.
That, and insurance doesn't cover unless you have pain. And like, how can you prove that your 1-month-old is having pain and discomfort? And, you know, and I hope that one day, you know, it is covered and that there is, you know, coverage around that. But I always, you know, I remind parents, like, you know, do they cover us for nutritional counseling? Do they cover us to go to the gym? Do they cover supplements, like good healthy supplements? No. And that's an investment that we each have to make in our own families outside of, I wouldn't call it healthcare insurance. I'd call it more crisis care insurance. It's there when, you know, there's a big red something happening to help support and protect us from that.
Yeah, absolutely. So I know that you mentioned a little bit about just opinions that anti-chiropractic people usually have, but do you think that there are common misconceptions about chiropractic within the Latina community, or that you have heard of based on your clientele?
I think the most common misconception that I get is like, when I go to a chiropractor once, I have to go for a long time or forever. And I always, you know, do I eat healthy for 1 month and then I'm like, I'm good for the year? You know, do I exercise for a week every month and then I'm good for the rest of the month? You know, it's a part of my wellness routine. And, you know, some people incorporate acupuncture, some people incorporate, you know, the amount of water that they're eating and types of food. And so it's not that you have to go forever. It's a choice that you end up making when you're empowered and learn about what chiropractic care truly is. Are we great at getting people out of pain, discomfort, baby stabilized, pelvic stabilized, baby's not crying? Yeah, absolutely. We're like really good at that. But the best use of chiropractic care is when you apply it as a wellness tool. That means, hey, your body is functioning at tip-top shape. Magic's happening there, you know, like our bodies are like functioning at top potential, like, but how do we keep that? And that's like the coolest part. And I would say we do it in all other parts of our life, and our society trains us to, you know, even like a 401k, or if you have a W-2 job, you know, we put a little bit away for retirement. We put a little bit away for retirement at each paycheck, and that's like what we do. We're trained to do that so that when we show up to, you know, retirement age, we have funds to spend at that age. But do we necessarily do it as a society or think of our health in that realm? You know, are we consistently eating, consistently working out so that when we show up to 65 or whatever age of retirement we are, you know, that we're moving great, we're feeling great, and that we are the healthiest versions of ourselves. So I feel like a lot of times in our society, we train ourselves, or we tell ourselves like, oh, you know, it must be old age. Oh, I hit my 30 and 35, 40, and I'm like, all of a sudden all these symptoms started to develop. It must be I'm hitting, old age. Must be getting older. And I resist that, It's like our patients are getting older, but they're feeling better, doing things that they've never done before. And it's not that, we're hitting old age, it's that we didn't apply enough wellness tools to bring us closer to health. Did we follow the average American diet? Maybe, and so we have more inflammation, more gut issues that are happening in our health that we just thought were normal, and that's just what we do in our society. But it's not until you choose different, you empower yourself to make those different choices. And that was a long answer to the common misconception, but it's, hey, I'm empowering you to make what's the right decision for you. It may not be chiropractic care. Let's get you on a better diet. Let's get you on a better, different track. Let's get you moving and functioning better from there.
Absolutely. As far as with the Latina or just, the POC community in general, do you think that they aren't as aware about chiropractic care compared to other ethnic or racial groups?
Another great question that I wasn't sure the answer, I think I hear it too often from every ethnicity. Like, I wish I knew about chiropractic care early. And it breaks my heart every single time because we don't know about chiropractic care. We don't know about prenatal pediatric chiropractor. We don't know that what an influence we can make when baby's still growing inside of our belly through chiropractic care. If we can reduce those stress hormones for mom, that baby's going to develop differently. That baby's neurology is going to be different. And that can impact not only baby now, but the way I like to think of it is every time that I'm honored to adjust a pregnant mom or honored to adjust a child, I'm not only changing their life, but I'm changing their offspring's life if they choose to go down that route, because their development is going to be so much different than the path that society has us on, And so I would say I hear that from just different ethnicities, white, Asian, everything, It's like, I wish I knew and I knew about it earlier. So, we try our best through social media. We try our best through different organizations that we participate in, are part of, that we send money to so that there is more research. But at the end of the day, those are all self-funded by all our offices throughout, the world. We don't have the type of pockets that the pharmaceutical industry has to fund these big research projects. And so I guess I always say, if you could share with one person the difference that it made in your life, I think it would make a difference. If your story and your journey can make a difference in one other person's life, like, how cool would that be that they can at least explore? Similar to my mom, someone would have told my mom, hey, have you thought about chiropractic care for Angie? It might help her with her immune system. I don't think I would have the autoimmune conditions that I have today. I don't think I would have needed IVF the way I did need IVF. I'm fully believe that it was my overuse of antibiotics that added to my immune system, autoimmune conditions that I have today. And so for me, I'm empowered to empower other ones. It's, hey, that was my life and that's okay. But that led me to help empower you to at least inform you and for you to choose if there is a different route for you.
Yes, I love it. I do wish that I would have known about chiropractic care way before I tried to conceive my first baby. But yeah, I'm glad that at least with you being here and me sharing and putting it out there, hopefully there can be other mamas or just people in general who can consider chiropractic care. And at first I thought that it was going to be hella expensive, but it's not. It was doable. I would say that if it wasn't for this chiropractor, shout out to Dr. Eric, it would have, I feel like I wouldn't have had such an easy labor breastfeeding experience, postpartum experience because of chiropractic care. So I really appreciate you just amplifying your voice through social media and also, by you being here just to educate future mamas or mamas that are currently pregnant or who are currently going through this journey to just consider at least having consultation. It doesn't hurt.
Yes.
Yeah. So now I'm going to switch gear and ask you Viva la Mami motherhood questions that I ask my guests. What is your meaning of motherhood?
For me, means stepping into a version of myself that, one, I didn't know existed, and two, that's not only teaching my children that, being their mother, but teaching me things that I've never learned or pushing me to a version of myself that I hadn't been before. And while it's really hard sometimes, and, the only motherhood that I know is part of it is, generational trauma that I'm trying to unlearn and relearn and reparent in a different way, knowing better, doing differently. So I think that's what motherhood is for me. It's allowing me to be the best version and a new version of myself.
Yes, I love it. And final question, what is one tip of advice you have for Latina mommies?
Always trust your mommy gut, mommy instinct. You will always have the right answer and that intuition, because you know your little one the best. You know your little one in your belly that's growing. You know the little one at birth. You know your little one, better than any provider will ever tell you. So just trust your gut. Just trust it.
Yes. I apologize for not calling you Doctora Angie in the beginning, because I do want to claim that, which power to you. So Doctora Angie, where can people follow you?
So they can follow me on our business page. It's at discoverbrightfutures.com. And they can also follow me at my personal page, which is at Angie, Angie, that is my full name, Recendez, Recendez on our social media. And I did want to also share a special offer. If you are local to the Chicago area and you're concerned about yourself or your little one, or you're pregnant or looking to get pregnant in the near future and exploring to see if chiropractic here can even make a difference, we are offering our consultation, which is normally $150, just for the 20 listeners of the podcast in the month of November. Mention the podcast and you'll get that for only $47. We do have 2 offices, one in the Pilsen neighborhood of Chicago and then the other one in Arlington Heights. So whichever one works best for you. But we only have 20 slots. So if that's something that you want to explore, please give us a call and we'd love to help support.
Yes, absolutely. Thank you so much for giving this opportunity to the listeners out there. So y'all heard, mujeres, take advantage of that. And I will make sure to share all of that information in the show notes. But Doctora Angie, thank you so much. I really appreciate you sharing your expertise and knowledge about chiropractic care, especially as it relates to fertility, pregnancy, and postpartum. So thank you so much for being here.
Awesome. Thank you. I'm honored.
Thank you for tuning in to the Viva la Mami podcast. If you like this episode, make sure to leave a review and write what episode really resonated with you. If you really loved it, share it on social media or with an amiga. As always, please subscribe to this podcast wherever you are listening. Make sure to follow me at Viva la Mami on Instagram or visit vivalamami.com. Please note the information shared in this podcast is for educational purposes only and should not be replaced by your healthcare provider nor taken as professional advice.